Hello. For the next few minutes, I want to talk about the most viral topic ever to hit the internet, as far as I know, which is COVID-19. Pun intended. It's a viral topic. Everybody's talking about it, from the hashtag flatten the curve back last year, which sought to take the steep curve, flatten it such that the healthcare workers and hospitals were not overburdened and morgues were not overflowing, and with the hope of getting a vaccine, which we got in late 2020, the governments intervened and mandated masks and restricted travel, closed businesses, and in some people's opinions, it was a government overreach, and that it was sort of an excessive response because there was not as much a risk, or perhaps freedoms and liberties and personal rights are more important than whatever it is the government was seeking to control or contain. But the end result is that we all had to suffer or deal with or enjoy the lockdowns, and still dealing with travel restrictions through early 2020, 2021. And it looks like we're headed towards this vaccine passport type of situation where if somebody wants to travel, then they'll have to show they've been vaccinated. And there have been political dimensions to a lot of these policies, just to keep people feeling safe. Apparently, in recent years, feeling safe, especially with people sharing their thoughts and opinions and feelings on the internet so much, and ideas spreading as widely and quickly as a virus, it's important to make people feel like there is a lower risk. When If we looked at that steep curve, now some people would have thought that everybody in this curve, in my impression, some people would have thought that everybody in this curve had an equal chance of death or had a high chance of death. And with early statistics, as COVID was developing in early 2020, the death rates coming out of Italy and Spain were quite high, and caused a lot of panic. And then, of course, in New York City, we saw overflowing morgues and, again, hospitals overloaded. But looking at this data from the Economist, we can start to, now a year into the pandemic and many months of data later, we can start to actually understand the situation with more precision and more accuracy, rather than the sort of emotional response that precipitated a lot of the lockdowns early on, which, again, some people think were excessive, at times, myself included, but not entirely. And at the end of the day, we just have to deal with it. That's my opinion, that I'm not in control of any of this. But taking mitigation strategies to avoid hospitalization and death is obviously a rational behavior. However, it is important to understand that whether you're a man or a woman, and what age you are and what underlying conditions you have, influence or affect how this virus might increase your risk of hospitalization or death. And so you can see, based on these thousands of cases from the United States that the Economist poured over, they've modeled these growth curves for risk of hospitalization and death. And you can see, as I switch back and forth between male and female, the risk for males is quite a lot larger for both hospitalization and death. And there are a lot of lifestyle factors, I suspect, play into that. Males more frequently smoke, they more frequently drink, they're more frequently obese. And so the whole story is not yet known, but we can see associated risk groups. And so when governments were intervening and implementing these policies, they did not target specific at-risk groups, they targeted the entire population. But what we are seeing is that this is not a population level risk. It's important for the average person to know that. If you're in your 20s and you're either male or female, I mean, if you're less than 40, really, your risk of hospitalization is quite low. Even if you're less than 60, if you're younger than 60, your risk of hospitalization is not great. Certainly if you're under 50, under 60, your risk of death is really quite low. If you're under 40, your risk of death is roughly nil. And so I am 42, and I know a lot of my friends, or at least my social media contacts, were spreading the idea that there were this enhanced risk of death for everybody, and that everybody who went to work and went shopping was somehow risking their lives. And I mentioned that in a previous video as sort of catastrophizing and overgeneralizing and having too simple a rubric, which is dangerous when we look at things through the lens of math and science, because that will lead us to kind of defy what is a more logical inference from the data. So what we can infer from just these graphs is that people's risk of death and hospitalization increases, and it increases exponentially. It looks like it increases exponentially and then kind of flattens off. The risk of death kind of peaks at around 11% for females, and just under, it looks like it's just going up to the peak level there as the age group ran out as the Economist assessed the data. Looks like about 90 years old is the oldest in their group. Whereas the hospitalization rate peaked around 78, 79 years old, around 31, 32% for males, and around the same age for females at around 20%. So you can see there's a significant difference just based on what these data look like on the graph between men and women. And then if we wanted to add comorbidities, we would see that, well, here's the baseline female, and then the comorbidity of obesity increases their risk of hospitalization quite a lot. For males, same thing, the risk of hospitalization increases to nearly 50%. And then if we add metabolic disorders, well, the range, we have a range here, there's variance within that metabolic disorders and obesity group, that up to 60% in some, so the range within that group increases, and up to nearly 40%, this is estimate uncertain for these older women. There just aren't enough data to provide that 90% confidence interval. And in general, research by standard methodology and practices, we should have a 95% confidence interval. Now, there's been some disagreement about why and if that's arbitrary, that we would require 95% in order to make conclusions from data or to be able to scale or generalize ideas about that data. But I think in this case, 90% gives us this type of analysis, and most of the analysis with regards to COVID, it is still developing because the data are still emerging, and the pandemic is still ongoing as of March 2021. So a 90% confidence interval is enough to give us a rough view. Now, we shouldn't take this as any sort of diagnostic or prognostic type of tool here, but the Economist has given us a pretty good view of how sex and then other comorbidities along with age increase one's risk of both hospitalization and death. And perhaps most importantly, it shows us that the risk of death does not really begin until after age 50. And that could relate to a lot of lifestyle factors. It could also relate to the idea that so many, well, obviously as the body ages, the health deteriorates and the immune system doesn't function as well. But there are non-comorbidities listed here, such as drinking and smoking and inactivity. As people get older, they tend to not exercise as much. They're a little bit less active. So there are other unstated factors that could influence this risk of death in particular. But still, the risk of death is quite small and nearly negligible for the lower age groups, even for males. That's very important to understand. So when we look back at that logistical growth model, that's kind of what it looks like here on the Economist curve. We can see logistical growth where it's not perfect, but it's how statisticians and scientists are modeling data. They get data and they generally follow these types of trends, where there is a peak, most certainly, and even when we were talking about flattening the curve, there's a peak in this curve and then it declines, and we can see these are more perfect models where if the virus were just let to spread naturally, it would reach a peak in the population because it couldn't spread between people anymore. And perhaps it would mutate, and this graph would change a little bit. There'd be another hump, or there'd be some other type of decay, or it wouldn't trend back down to zero. But theoretically, the virus spreads and spreads as it spreads between people. If one person spreads it to 2 or 3 people, that would be what's called R0, if you're paying attention to some of the viral statistics, virology statistics. The number of people each person spreads it to then increases. So if one person spreads it to 2, and those 2 spread it to 2 more each, and those 4 spread it to 2 more each, then it grows exponentially 2 to the x being the number of days or the number of cycles. And so if you even take 2 to the power of x, it increases rather quickly. And then it would reach a peak because there are only so many people in the population. It could not spread any further. And so then it would fall precipitously again. By spreading out that curve, we get a less exponential type of curve, and it's less generalizable. It's not as easy to model, although again, computer programs and algorithms can take best fit. We can model we can use algorithms to model some polynomial type of distribution, polynomial type of function there. So looking at what is theoretically the logistical growth model. For the Economist, I've already plotted it out here on GeoGebra. Now, it's important to understand that this is not a perfect model, and if we look at the Economist, we can see, again, it's not exactly exponential. It looks almost linear through some phases, but there's definitely a peak, and it definitely, for death rate, for sure, it looks exponential. It follows that very slow growth, and then increasing growth, and then increasing growth up to a level where it's probably no longer growing, or at least it would cut off because only so much of the population lives to over 90. So if we take this model, 0.32 is our maximum. That's about 32%. Again, that was for males, 32% hospitalization risk. If we found the data suggested 30% hospitalization risk, then we could change that top number, right, and the peak would fall. But they found about a 32% for a peak on hospitalization. And then again, just looking at these different parts, we've got P of T, the population of whatever this bacteria or virus or whatever it is. Y equals C, which is our maximum, so 0.32, divided by 1 plus A, which is a constant. E, again, it's a constant, but it's our exponential constant, raised to the power of negative bt, where b is greater than or less than 0. And these coefficients, these constants, are going to be found through modeling data, and these are complex algorithms that are best suited for computers. But we can see how the growth rate changes when I take that 100,000, change it to 1,000. We can see the growth starts earlier and it increases at a faster rate. If I increase it to 1,000,000, we can see the growth starts later, and maybe even this is closer to what we have at the Economist. And if I change the exponent here, we can change the slope of the curve. Again, we can change how the curve looks by changing these different numbers. And so just by manipulating these points, these parts of the equation, we can change how the graph behaves quite a lot. And so it's important to understand that this is not a precise measure, and that only through careful study of the data, like at the Economist, would they be able to model some sort of exponential or logistical, this would be logistical growth curve. And even here it's not perfect, because in real world things just don't work out like they do in the math textbook so much. This is a very smooth, perfectly logistical growth model. And then on the other end we've got decay. So if we wanted to look at these types of models here where we had the curves, right, when we were flattening the curves, this is the daily transmission rate. Now, the actual number of total cases will never come down because it only accumulates over time. And so that's logistical growth. This is very clearly a logistical growth model. The total number of cases, total confirmed cases. This is from mainland China, excluding Hubei. But then the daily number of confirmed cases, that's that curve that we wanted to flatten. So we can never flatten the total number of cases, but by reducing the number of daily cases, and you can see here are the actual data, the reported, and then there's a smooth logistic growth function that's modeled onto that by taking averages and doing some fairly complex mathematics that's best suited for computers because of time, really, just efficiency. So if we wanted to look at that, again, I've got to change the range here. If we wanted to look at the total number of cases in a day, or total number of cases over some time, then we just have to change those values in the logistic growth model. And we get something that looks like that, right? So this is the maximum number of cases. Let's just say that in a perfect world, the virus started off, it grew up, it spread between people, and then bang, we have a perfect intervention, whether it's total vaccination or herd immunity or whatever, and that number of 1,000, whatever it is, we could scale that up or down, 1,000 million or whatever. That number of cases will never grow larger because that would be the end of the virus transmission or whatever it is. If it's a bacteria colony growing, then it could never get past that number of total number of bacteria cells. But then what we really want to see is something kind of like that, right, where we have a growth and then a decay. That's what we're talking about when we're talking about flattening the curve. And so this would be something like that would be the total number of cases where it's never going to come back down. And then something like this is the number of daily cases or their number of hourly cases or the number of cases within a time period where it grows because the bacteria or the virus is spreading between people in a sort of unchecked way. And then at some point it reaches a peak because either herd immunity or people are taking precautions, they're wearing masks, they're washing their hands more, they're not gathering in groups, they're not going to bars and restaurants, etc., they're not traveling, whatever. So for a number of different reasons, that daily transmission or that hourly or weekly transmission peaks, and this could also be the death rate, peaks because that's just the point we've reached in the population where the mitigation methods have been effective, and so then it would start coming back down either because, again, vaccination or because of all of the interventions, lifestyle changes, etc., would bring it back down, ideally to zero. Now with COVID, what a lot of doctors are saying is that it's probably not ever going to be zero. And again, we can toy with the different parts of this equation to change the exponential growth rate. We can have it steeper. We could we can start the process later, right? We can increase the maximum. We can change the skewness. Right? All these different parts of the equation will change how the graph moves. And you could look on the internet like I did and find a number of different professional statisticians came up with models for transmissions in different countries, and they're using complex mathematics, differential equations, and things that, again, are best modeled on computers because they are more efficient. And certainly to write an article like this and to pour over thousands and thousands, maybe even millions of data points, By hand, it would take a team of people months to do. So even with computers, it takes teams of people months to do. And so you can see the actual mathematics of modeling and coming up with these estimates and curves is really quite complex. But it all does come from those general logistical growth and decay models that we learn in early high school mathematics. There are a few other different variations of those generalized growth models, and with regard to COVID-19, this R naught has been a main focus. And you'll see here 95% confidence interval, which is set different from what we see here at the Economist 90% confidence interval. As I was saying earlier, the 95% confidence interval is sort of the gold standard for peer-reviewed publication. And so it's rare that you would see a peer-reviewed article with a 90% confidence interval. Most scientists would just ignore that. And that's for good and bad reason. For good reason and also somewhat arbitrary. But that R naught is the number of people each infected person spreads to, right? So in mainland China, the R naught, you can imagine that people in China are more densely populated than in Iran. So the average Chinese person who is infected then infected 3.59 other people. And that would increase the growth rate. It would increase the speed at which the virus spreads. In Iran, slightly lower, the Philippines 3. And again, you can infer that because people are more densely populated in mainland China and they're interacting more, they're living more in apartment buildings in cities, and there's more walking, there are more people on the street, there are more crowds, that it would spread faster. In Iran, there's probably more rural area. People are a little bit more, shall we say, privatized in the Islamic culture. The women are not out in the street nearly as much, not working nearly as much, so that certainly affected the spread rate. Philippines, similar to mainland China, but we can infer that probably the number of different islands in the Philippines would have led to a reduction compared to mainland China. And then Taiwan, they were early on with mitigation strategies like wearing masks, and so that most certainly helped reduce the spread. Plus, the population density is it's just not as great. And so there are a lot of different parts and pieces to coming up with these models. It's important to understand that they don't follow those smooth growth and decay curves like we see in mathematics textbooks, because the real world is a little bit messy and there are variables that are impossible to control for and to factor into every mathematical model. But we can come up with generalized models which are still very helpful. So a main takeaway here when looking at this data, and as data keeps coming in, and people will be talking about this for years at 95% confidence interval, I'm sure. Main takeaway is that the death toll, while remarkable, COVID was the number 3 cause of death worldwide last year in 2020, and so that's definitely substantial. However, it wasn't that type of threat that, the zombie apocalypse style threat that it seems to have been made out to be in popular media, whereas people more mathematically and statistically inclined would understand that these different risk groups exist, and this isn't a population level risk such to the extent that every person of every age is equally impacted, and certainly there are lifestyle factors and underlying conditions that are as important, if not more important, than age. And so then when looking at the next pandemic, it's possible that we might see different risk groups categorized differently, even though that would probably cause concern about unfair treatment if certain risk groups were subject to different treatment. But if we phrased that in the manner that we're protecting the higher ages, and we're protecting people with underlying conditions by requesting they voluntarily comply with certain directives, or that they be given special treatment at work if they want to work at home rather than come into the office. There are certainly ways that there could be a more nuanced and detailed approach to another pandemic rather than depriving all young people of their rights to education or socialization, or taking all people in service industries who are in the prime working years out of their jobs such that they would have to file for unemployment and many go bankrupt. Certainly all the small business owners. So many millions of small business owners in this prime age group who faced very low chance of death and even low chance of hospitalization went bankrupt and had their entire lives changed, or certainly the next decade changed, because of a response which was, in many people's opinion, heavy-handed, of course in many other people's opinion completely necessary. But I think that opinion does depend on which risk category you fall into and what your tolerance of risk is, and then what mitigation strategies you're willing to implement on your own voluntarily, i.e. masks and social distancing to a reasonable degree. So, long story short, keep looking at the data, keep understanding, or at least try to understand the complexity of the data, and know that there are base mathematical functions and formulas that people are learning in high school which are more complicated at this higher level of practical application in the real world, but the basics are still in there and fundamental to coming up with these complex models. Okay, thank you.